In this video, we'll talk about 3 reasons why your ponytail may be shrinking. These reasons are causes of hair loss that can cause general globalized thinning, or sometimes even focal thinning that can result in thinning down of your ponytail. That can be pretty scary for a lot of people. Before we get started, I'd like to thank each and every one of you for picking up a copy of my book, Six Skin Skincare Made Simple, on Amazon Books, reading it, getting some benefit from it. The response has been amazing. Pick up your copy today if you haven't already at Amazon Books at the link below or at the QRS code to my side. Now let's get on with the video. So 3 reasons why your ponytail may be shrinking. The first reason, which is actually a pretty common type of hair loss, is female or male pattern hair loss. Both types of hair loss can lead to thinning on top of the scalp over various areas, and in certain types, these hair loss cases can actually take leaps forward and thin down tremendously quickly. And that can be very, very scary for the sufferer, for the person who has the condition. So in those cases where female pattern hair loss or male pattern hair loss take a leap forward, the ponytail may be thinning, and you could notice it very, very abruptly that the ponytail has thinned down after years that nothing seemed to have happened, even though in most of those cases the hair loss was ongoing for many, many years, and sometimes it takes a leap forward. I'll explain in a moment what type of other kind of hair loss could be involved. Sometimes it's just the male or female pattern hair loss. Sometimes there's another type of hair loss that is very sneaky that can piggyback its way on top of the chronic progressive hair loss that is the female or male pattern hair loss. Now, the second type of hair loss that can cause thinning of the ponytail very abruptly is frontal fibrosing alopecia, or LPP, lichen planopilaris. Those are variants of the same condition, or thought to be that way, and that can be a very rapidly progressing condition as well. This condition is an inflammatory condition that affects the hair follicles, creating an irritation around the hair follicles and often causing destruction of the hair follicles in a way that is irreversible, scarring hair loss. So that is a very serious type of hair loss, needs to be diagnosed very quickly and needs to be taken charge of effective immediately so you don't lose critical amounts of hair and the hair follicles remain intact. Treatment is exceptionally difficult for a lot of these cases, so you need to have a second set of eyes on you if you are suffering from frontal fibrosing alopecia or lichen planopilaris. There's various treatments for these types of hair loss, from the local, topical, and even oral medications. Some cases respond to PRP that we've talked about in previous videos. That being said, you need to see a dermatologist to make sure that you know what's going on and that is being treated appropriately. The third type of hair loss that can cause thinning of the ponytail, and that is the most common type of hair loss to cause thinning of a ponytail, is telogen effluvium. Telogen effluvium is a very interesting condition. It starts roughly 3 months, classically, 3 months after a major traumatic event in someone's life. Now, a major traumatic event is sort of a fluid definition. It could be actually a real bona fide traumatic event, like death in the family, God forbid, a road accident, major surgery, major illness, a child delivery. Actually giving birth can cause telogen effluvium. And in some cases are less dramatic, really. They're maybe starting a new medication or moving to a new home, or things like that, but certainly something that is out of the ordinary. 3 months later, after the inciting event, people experience this abrupt, very widespread, significant hair shedding that can be very scary. Clumps of hair coming out in the shower, clumps of hair on the pillow, clumps of hair everywhere. And that concerns people greatly to seek medical advice. A lot of times they show up in our office and we take a look and we know what's going on. It's telogen effluvium. Telogen effluvium under those circumstances, meaning 3 months after the dramatic event, usually turns around with time. So there's really not a whole lot to do. And telogen effluvium can actually piggyback on top of a chronic hair loss like male or female pattern hair loss, and can make it seem like it took a jump or a leap forward and got much worse, where in fact it's just the telogen effluvium kind of just brushing through the scalp, causing all sorts of hair shedding that is usually reversible, especially after the 3-month inciting event telogen effluvium type. Now, there are types of telogen effluvium that turn chronic. Those are divided into 2 separate categories. The The first category is something that is pretty much idiopathic, meaning it has no recognizable or discernible cause. That type of telogen effluvium, chronic telogen effluvium, we're left to treat with regular treatments that work for other types of hair loss, specifically for female or male pattern hair loss, with varying degrees of success. It's actually a pretty stubborn type of hair loss to treat if it doesn't reverse itself. The chronic type of telogen effluvium that is treatable in different modes is telogen effluvium that occurs because of some hormonal dysregulation or nutritional deficits, and those we need to take a look at. So we need to do some blood work if you have chronic telogen effluvium to make sure there's no underlying issues, nutritional or hormonal, to make sure we don't need to correct anything, and then we can get ourselves busy with treating the telogen effluvium and trying to reverse course to get you some of the hair back. If you've gotten some benefit from this video, share, like, and subscribe. Tell us in the comments section, what type of telogen effluvium are you suffering from? Are you suffering from any sort of hair loss that is not turning around with appropriate treatment? Tell me in the comments section. I'd love to hear more about it. And also in the comments section, let me know what subjects or topics in skincare or dermatology, healthcare, or otherwise you'd like me to cover in the upcoming videos. Thank you so much for watching this video. More great content coming your way right from this channel. Thanks for watching once again, and God bless.